Welcome to Pushing the Limits, the show that helps you reach your full potential, with your host, Lisa Tamati. Brought to you by lisatamati.com.
Everyone, welcome back to Pushing the Limits. This week, I have my favorite doctor, Dr. Elizabeth Yurth. Now, Dr. Elizabeth Yurth is from the Boulder Longevity Institute in Colorado in the USA. She is a longevity expert. She is also an orthopedic surgeon, an orthopedic specialist, and today's topic is arthritis and everything around arthritis. And arthritis is a disease process. This is a really new way of looking at arthritis, and you're going to find a whole lot of value in this. Everyone, welcome back to Pushing the Limits. This week I have my favorite doctor on earth, Dr. Yurth. Welcome to the show, and I'm already rhyming poems this morning. How you doing?
Lisa. My favorite podcaster.
You had to say that, didn't you?
And human being.
Today, I don't know how many times you've been on this podcast, but you're really absolutely fantastic, and you're looking after my mum, so what's not to love? Today's topic, though, is one that will interest a whole lot of athletes out there, I think, and also just people that are dealing with arthritis. So arthritis is the theme of the day. And actually, even though it's about arthritis, this ties back into all the big diseases, which is really what I'm interested in digging into. So, Dr. Yurth, we have this sort of perception as the lay public, if I can speak for the rest of the world, that arthritis comes from when you have an injury and you start to break the cartilage down, or the joint gets worn down, and it's a wear and tear disease. Why is that not quite the full story?
So it's really a huge misconception and understanding of arthritis. And it's funny because we wouldn't think of dementia as you used your brain too much and you wore out your brain, nor would we think about heart disease as, wow, your heart beat too many times, so you wore out your heart. And yet somehow we think about our joints wearing out as, oh, you just used your joints too much. And it's funny, I was talking actually to my yoga instructor who needs a hip replacement, and she was saying, yeah, it's just signs of a life well lived. And I was thinking, no, it's not. And so just like what we're becoming more aware of is that this is an inflammatory disease process, just like brain disease, cardiovascular disease, metabolic disease. It's all part of that what we term inflammaging, a disruption in our immune system that leads to a destruction of tissue. And whether that tissue is your heart or your brain or your joints, it's all the same reactive problem, which is your immune system goes haywire. Mm-hmm. So, and you're right that this starts with those little injuries, right? So we know, for instance, that if you tear your ACL, I tore my first ACL when I was 16, 17 years old. If you tear your ACL, your likelihood of developing arthritis is 80% by the time you're 50. Wow. So it's really high. And that's if you did surgery and we think, okay, it's all fixed, you're good as new. Not. So we know that process starts even when we're young and we have these little injuries. Or, somebody like you who you think, okay, well, I just put so much wear and tear on my joints. Well, every time you're running, right? Every time you're putting that load on your joint, there's this inflammatory process going on. And our body's designed to get this inflammation and start healing the joint, right? Mm-hmm. That's a normal response. The problem is when that inflammation stays up, and so we get this imbalance of these pro-inflammatory reactions without the secondary step, which is the anti-inflammatory or healing stage. So it's the same thing, right, that goes on with COVID, right? Mm-hmm. Yep. So why do some people die of COVID? It's usually not, the virus itself, it's the immune reaction to the virus. Yeah. So people develop this what we call cytokine storm, right? They get the COVID virus, and some people get rid of the virus and they're fine. And other people, and we're seeing this with the COVID long haulers too, right? Other people instead mount this big, huge immune response. And that immune response starts attacking your blood vessels and your heart and your kidneys. So it's the immune response to the virus that sets off this cascade of reactions that ultimately kills you or creates long COVID, the COVID long haulers. It's the immune reaction, to this virus. And so the same thing happens with these joints. It's our immune systems overreacting to injury that now starts to degrade the cartilage. So, that's why what we're doing isn't working. Why,
because that's what I wanted to dig into. So this is an inflammation or inflammaging process, and this can happen even with young people. I mean, I'm dealing with a young man at the moment, an athlete, got very, very young, major issues. So it's not just a disease of old people. It is partly genetic, partly environmental, partly injury, and then this disease process that happens. So why is this sort of similar to the things like heart disease and, all of these neurodegenerative diseases, heart disease, all these things have that one thing in common, as you said, an increase in the pro-inflammatory cytokines, chemokines, all of those ILs. I can't even remember all the ILs, IL 6s and 1s and 15s and 18s or whatever they all are. All of those things go up. Why in the healthy person? So like I've run, 70 or more than 70,000 kilometers, and I don't have arthritis. And I had a very bad back injury and I had arthritis in the back, but I have no pain now in the back. Why is that? When you would consider that, someone with no discs left and 4 of their, things, I should be in pain all the time. And I used to be. Why am I not now? Why am I know sort of why I'm sort of getting to the point of, okay, I've got less inflammation in my body going on because I know, because I've been learning from people like you. Why have I not got the pain that I used to have? What's actually going on there?
So you're exactly you're exactly right. When you say this is a conglomerate effect, basically, if you have, perfect genetics, so there are some people who can even live life poorly, right, and have perfect genetics. Most of us don't. So, it is a combination of genetics and environmental factors, and then those things propagated by trauma. So, I like you. So I tore my first ACL at 16, tore another one. I've had 4 ACL reconstructions. I have end stage arthritis in my knees. My knees have no cartilage left in them, but I have no pain, right? I have, my knees are not particularly stable. I have to brace them for, doing things like skiing, but I don't have any pain in them because I've gotten my inflammation under control. So much like you with your degenerative discs, we know that degeneration in and of itself is not the cause of pain. It's the inflammation. So what happens when the body suffers an injury is you do get very high levels of things like tumor necrosis factor alpha, interleukin 1, interleukin 6, interferons, things like that get elevated. And then that sets off, this response to healing. Now, the next step should be really within, a few days, those go down and we start seeing these anti-inflammatory proteins like interleukin 4, interleukin 10, things like that come into play. So now, the balance goes from this to this, and we can heal and recover. If it stays here, the next step is you start seeing damage to the cartilage cells.
Right.
Now, go back to the same thing that happens with heart disease or, brain disease. The same thing that, maybe you have this underlying genetic piece, and then you're eating a little bit of a poor diet, or you're doing something that's not quite right, and you set off this inflammatory cascade. So what's the next step to all this stuff? Well, what we know happens next is that these damaged cells, whether it be in your heart or your joint, create that. Remember, we've all talked about that senescent cell.
Yes.
Basically the injured cell and what it does. So what we know happens in joints or in your heart or in your brain is this in the joints called chondrosenescence. So the cartilage cells are damaged. And instead of, again, we're going to go back to when cells are damaged and they get old and have too much trash accumulated in them, what they should do is kill themselves off. That's the autophagy piece, right? When that's disturbed, those damaged cells create proteins that start damaging themselves, other cells. So now it's why when you get a little tiny injury, all of a sudden it'll start propagating. Like you'll see somebody have a little injury to their joint, and then 3 months later you re-image the joint, and it's like worse, and 3 months later worse. And it's not as though you're continuing trauma. It's that basically these damaged cells beget damage. So they start spewing out these proteins. So we call them zombie cells. These senescent cells are called zombies, right? Because they spew out these proteins that damage the cells around them. So we know that there's a lot of pieces that go awry. Basically, too much inflammatory cytokines, based on genetics a lot, but also environmental influences, diet, right? Those are all things that play a role. Toxins, toxic exposures, right? So again, if you had perfect genetics, you could probably fight off all that stuff. But since most of us don't, now you've got these environmental exposures. So first thing, we have these high inflammatory cytokines. Second thing, we start getting cell damage. So we basically have senescent cells. Third thing is we lack autophagy. And so now we're linking this lack of autophagy or getting rid of damage as a big piece to arthritis as well as other diseases, right? So if we look at where we failed in treating this problem, so let's look at the traditional treatments. Okay, so number one, you go in. So first of all, let's start with that first injury in my 16-year-old. Instead of just doing surgery and sending them on their way, should I be really focusing on, okay, I did surgery and I repaired your ligament. Now let's make sure you heal appropriately. So we need to turn off those inflammatory proteins at some point. So we can use simple supplements to do that. You know, things like epigallocatechins, what's in green tea. So you can use some, curcumin, things like that, simple supplements to turn down that inflammatory response so that the person heals more appropriately. So in our patients, when we have a young person who has an injury, we get very aggressive in utilizing an approach so that they don't start that cascade right then to having arthritis when they're my age, right? So that's number one. You've got to turn off these pro-inflammatory cytokines, whether it be in that young person or in somebody my age who's presenting with inflammatory joint pain, or you with your disc disease, which are frankly the same disease, whether it's degenerative disc or degenerative joint. It just depends on what part of the body seems to get more attacked. But so we've got to turn down these inflammatory cytokines. Second, what we have to do is we've got to get rid of the damage. So you have to induce autophagy.
Autophagy.
Right?
Can you remind everybody what autophagy is? Knocking off the damaged cells.
The damaged cells, exactly. It's self-death. So basically autophagy means self-eating, autophagy, self-eating. So what cells are designed to do is when they accumulate a certain amount of damage, so you have these nice young healthy cells, and then they start going through cell processes, oxidative phosphorylation, and start accumulating damage. And they're designed when they hit a certain point to have so much damage that they go, oop, time to go. And they kill themselves off and they recycle the good parts. That's what autophagy is. If they don't go away, and why don't they go away? Why doesn't that autophagy occur? Mostly because of genetics and diet and environment and, lacking, appropriate responses to this. So age in of itself induces a lack of autophagy, at least if you're not doing everything appropriately. So basically that if that's cell death doesn't occur, that's why the zombie term is perfect, right? These cells should be dead. They should have killed themselves off, just like dead people should die. And if they don't, they become zombies. And what do zombies do? Their goal is to take over the world because they want everybody else to be zombies. So they start killing everybody around them, turning them into zombies. That's exactly what these damaged cells do. They start.
So they're like an infective. They sort of infect all. It's like the bad apple in the barrel. It's a little bit like why, who knows? But it's probably just this. It may have something to from in a kind of a protective response. When we're growing and developing, you want some autophagy. You don't want overgrowth of cells. You want some autophagy for cancer protection too, right? So basically, you don't want these cells to keep growing because that's going to also cause cancer. So there's always this balance in everything. So basically that autophagy process we now are linking to a lot of diseases. And it's funny that arthritis or joint pain or back pain, in all the talk about anti-aging medicine and all the longevity clinics, nobody really focuses on it, right? That seems to be kept separate. Everybody thinks about metabolic health and they think about brain health and they think about, cancer and things like that when we're doing, but they don't think about arthritis. And yet, if you look at one of the most debilitating things that happens to us as we age, it's a lack of being able to do anything we love anymore, right? My dad, who, lived to be 91, 92, he was a super fit guy. He was climbing mountains and skiing in his 80s. And then when his arthritis got so bad, he honestly and couldn't do anything anymore. It sort of was his downfall, right? He sort of started losing his desire to live. Thing. Because when you're in pain and you're not gonna, have your quality of life.
Exactly. Like somebody like you and I who live a lot of our life based on, we love being active and doing things. when you take that away from somebody,
Yeah.
you know, quality of life really goes.
Yep.
So we keep focusing on these big bad diseases that, yes, will potentially kill you, but here's a disease that ultimately completely, and it's one of the most common causes of disability. It's way above heart disease and, you know, and all
Wow.
these other diseases as a cause of disability. Even in young people, you know, it's the number one leading cause of disability in people of working age.
Yeah.
So it's the main reason people get out of the workforce even.
And this
yet
is so
you know,
preventable to a large degree, despite genetics and stuff. But our
treatable
approach,
once it occurs, right? So that, like you
Yeah.
said, you have no discs in your back. I have no cartilage in my knees, but we don't have pain
no,
because we've gotten our cell health to an optimal level where we don't have all these inflammatory things going on. So,
and I notice immediately, like if I have a couple of glasses of wine and eat something bad, and then the next day, you know, without fail,
exactly.
I have
Yeah.
more pain in my body. And so I've linked those two events together in my head, but most people don't, because they're living that way maybe all of the time,
All the time,
rather
right?
than on
Yeah,
an
you don't have a
occasion.
good days.
Yeah. And so they just think that pain is normal, and that's just a part of the you know, the arthritis process, when actually, and having come from having a very painful back, and, you know, and in my case, doing too much running, causing too much inflammation and all of that. And now not having it, my God, my life quality is just so much better when I don't have to deal with that pain. And unfortunately, the sort of traditional approach is either surgery or arthroscopic, you know, knee surgeries and things, or it's steroid either injections or steroids, taking them orally, which why is that not a good idea? And why, you know, if we go through arthroscopic treatments and steroids, why are they not great?
So let's talk about
They
kind of
have
traditional
place.
treatments. You know, because I come, you know, my background, Lisa, is orthopedics, right?
Yeah.
I come from this traditional orthopedic background. I mean, it took me a long time to say, wow, what I'm doing is really, you know,
Not working.
not helping, right? You know,
Yeah.
and come, but your orthopedic doctor doesn't want to hear that, right? They don't want to hear that their bread and butter, which is, you know, steroid surgery, you know, joint replacement, is not right. So let's look at, like, you know, when you look, for instance, at steroid injections, you know, well, steroid injections temporarily are going to reduce those inflammatory cytokines. You will feel better.
Good job.
But they also are going to reduce all of those anti-inflammatory cytokines that help you heal. So we know very well that steroids are a double-edged sword, and that we know that there's at least a dozen studies out there now that show, yes, they have some temporary benefit, with the long-term being that the disease will progress more rapidly. So, you know, they're used as a temporizing measure, and in most orthopedists' mind, let's do them steroid injection. Ultimately, the goal is you're going to need a joint replacement in a year, right?
Yeah.
And they'll tell people that, yeah, this will get you through until we do their joint replacement. And they wait until it's progressed, and they are actually helping it progress a little faster so they can get to their joint replacement. And, you know, and that's their ultimate goal, because that's where the money is.
That's where the money is, doing replacements.
You know,
and, you know, sometimes it is necessary.
Can be helpful, right? I mean, if
In
you've
the last
got
instance,
end-stage arthritis, it's a last
Yeah.
resort. You know, replacing the hip, replacing the knee can definitely be helpful. I'm not going to sort of say it's never something we want to use,
No.
but the goal would be, if we can start addressing this problem when we should be, which is when injuries start first occurring, just like all these diseases, you know, then you shouldn't have to get to that stage.
Exactly.
Where, you know, so we know that steroid injections are a double-edged sword. Yes, they help temporarily, but they're progressing you further down that road.
Yeah.
So then you look at, okay, what about what we do a lot here in the US, and you guys do a little bit less, is arthroscopic surgery, where somebody comes in with knee pain, and they're like, your surgeon goes, well, you know, yeah, you've got, you know, some damage to your cartilage. Let's just go in there and trim it up, and, you know, clean the joint up. Let's clean it up. And I always tell people, well, that'd be a lot like me going with my dementia to my, you know, my neurologist, and them saying, let's just trim out those bad parts of your brain. You know, I mean, or your heart rate. It makes zero sense. And yet somehow people think it makes sense in a joint to go clean out the damaged cartilage. Well, what we know is that arthroscopic surgery, again, may provide some temporary relief. It seems to actually maybe offer a little bit, but not much more rapidly progresses the arthritis. In fact, sometimes a very rapid decline. I just saw a patient last week who had a little tiny cartilage tear in her knee. My age, like 60 something, and she had a little tiny cartilage tear in her knee. And, when had surgery, oh my gosh, she so rapidly, you should see the MRI scans, really 3 months apart, went from a little tiny meniscal damage to full blown horrible knee. Because think about back what we just said. What did that sticking a scope in the knee, trimming up things, what did it do?
Caused inflammation.
Caused inflammation, right. So now we just got all these pro-inflammatory cytokines escalated, started that whole cascade of events to damage more cartilage cells, which damage more cartilage cells. So it's just frankly dumb to think we can go do that. And study after study after study, there's just another one that just came out, shows that it is not helpful.
Yeah,
it's the number one surgery.
And it's still ignored. It's still done every day in every hospital. What about back fusions? Are they different?
Well, so let's look at back fusion. So basically, why are you doing a back fusion? Basically, the only time back fusion is a successful procedure for any kind of long-term benefit is if you have instability in the spine. So some people, the spine actually becomes unstable enough that when they're moving, the vertebrae are shifting back and forth. If I can stabilize that segment, I do help with their pain. But if people just have degenerative discs and you're treating them with a fusion, the overall success rate of that surgery for long term is about 10% of people are better. And it's a little unclear even why that many are better. Because again, have you treated the disease process?
Yeah.
No. And again, what have I done if I fused L4-5? And you see this all the time. The people come back a year later and they're like, oh, now L3-4 looks bad. Let's use that one, then L2-3. Because actually, again, even though that segment's fused, it has no motion and you're probably not going to have pain at that level. The disease process is occurring at every other level of the spine.
Yeah.
And now with this, there's a great study I always show, all my patients that came out last year that showed that degenerative disc disease is an inflammatory disease, very much so.
Yeah.
And they showed very high levels of interleukin-1 beta and interleukin-6 and something called nuclear factor kappa beta. And so, and if you in mice, if you blocked those and you stuck a big hole in the disc, nothing happened. So we know we have to treat those and not the disc itself. That's the end game. Treat the problem that's causing the disc damage. It's going on at every other level. It's also why degenerative disc disease, degenerative joint disease those patients have higher risks of cardiovascular disease.
Exactly. This is the other thing. Like this is it's a warning signal, isn't it?
Right.
Because I'm got my brother at the moment who's had a hip replacement, and now the other hip's going in his mind. That's logical progression, right? It's I've done this, and I'm like trying to get him to understand that this, and it's only moderate at the moment. We may be able to save you from having this, or at least delay this and have a lot less pain in the meantime if we did these XYZ, in which we're going to get to in a little bit. But it's a hard jump. It's a mechanical thing.
Right.
I've got mechanical damage from a mechanical thing. One hip was gone, so therefore the other is gone. And I'm like, actually, if we look at your, cardiovascular health, cholesterol, all of these things, you'll start to see that all of those processes, and this is just generally speaking now, all those aging processes are going on in the body elsewhere, and it's showing itself. And this is actually a big warning sign. It's like, when I have something bad and eat bad and drink bad or something, then I get more pain in the body, and that's a definite correlation. Then that's a wake-up call. And by the same token, when someone has this degeneration, it is a wake-up call to actually go, I need to step back and re-examine things like your diet, your supplement regime, your exercise regime, and all of these things. And how do I get my pro-inflammatory cytokines and chemokines and everything down? And how do I increase the anti-inflammatory? So I think that's, sorry. Yeah.
I mean, you're exactly on. Like, your brother's that classic patient, and they, and they keep getting reinforced by their orthopedist to say, oh, well, of course your other hip's going to go because now it's going to take more load. you know, and then you see the knee go, and they're like, yeah, well, now that's because we altered the gait a little bit, so your knee's going to go. You know,
It just
the number of
knocks
patients I see
on.
who go first hip, and then second hip, and then knee, and the next knee. And
Yeah.
is this ever a wake up call that
No.
something else might be wrong? You know, honestly,
They just still think it's a mechanical thing
No.
from walking different or, you know,
Right.
going different. And it's a simplistic, it's a simplistic
it's
way.
not
of
from a
looking
life
at it.
well lived. It's not from overuse of the joints. You know, like I
Otherwise,
said,
I'm buggered and you're buggered long ago.
you know, yeah, it's you know, it's huge. And, you know, I can look back now and say there's a lot of things I would have, you know, done differently to not have my knees where they are right now. Right. You
Yeah.
too, like, you know, that for you was probably an overtraining phenomena. For me, probably, you know, stress and, you know, so my genetics and poor sleep and all the other things that I did, you know, so there's a lot of pieces. And the problem is when we're young, we actually don't think that way, right? You think,
Bulletproof.
oh, an injury, I'll get better, or, you know, I can do anything. I can, you know, I can not sleep. It's okay because I'll sleep when I'm old.
Yeah.
You know, and all those things. That's where we have to start educating people. We're really trying to get into the heads of these, you know, 20-year-olds and say, you know, this process is starting when you're 20. Just like your
Yes.
brain diseases and your heart diseases and your cancers are. All those processes are starting in our 20s. You know, I'm playing catch up to, you know, damage done.
Yeah.
It'd be a lot better to prevent the damage in the first place.